I know the clinicians in private practice know it's a really great comfort to know there's such a great facility that patients can be referred to.
From my placements that I've done out in practice, this hospital definitely seems to be the most advanced that I've been to.
You know, at the equine unit and the companion unit, I know that there are always people there 24/7, so you can just ring up if you have any problems, and you know, there's always someone on call to help out. And I know that, especially because it's a teaching environment, a lot of the stuff is pretty well state of the art. Like a lot of the knowledge, the specialists that are on campus, you know, they can always provide information to the GPs that are handling a case, and they've just got that wealth of information at their fingertips. They can go out at the drop of a hat, you know, all the cars are ready to go with all the gear in there, and you know, to go out to a calving or a caesarean section or anything like that, they're very well equipped.
When a client arrives with a horse, they bring the horse in and unload, and the vet will explain to the client that we're a final year student and that we'll gather some history. So assessing the situation and when it's appropriate, we have some questions that the Equine Centre would like us to ask, and then we in our own natural way can talk to the client and gather some history and any concerns that the client has and anything that the health centre really wants to know as well.
Yeah, referring's a good way of getting a really good outcome for the client, especially if it's something that your practice isn't well equipped for, even you as a new grad aren't well equipped for. So it's good that they sort of teach us to know our limits and know when to refer.
We have a range of specialists here in oncology, dermatology and surgery, also in anaesthesia. And we have access to excellent imaging services such as radiography, so that's x-rays, and a CT scanning unit. We have a really good ultrasound unit.
I think it's very important that the clinician explains to the client first that we're a teaching institution, and the primary job of our university is to teach, but also at the same time provide a good quality service. I think the benefit for the client is that the case will be discussed in depth with the student, and more can be drawn for the particular case, especially if it's a complex case. More brains involved, better to get a diagnosis.
This also benefits the animals themselves. They get a lot of attention here. We have that time and we have the thought and we have the intention to do the level best that we can for those animals.